Good morning, everyone, and thank you for joining Mayor Woodfin on this Tele-Town Hall conference with city employees. We have many people on the line. We know many of you will have questions. You can ask a question by pressing 7 on your dial pad. You will talk to a screener, and we will put your questions in the queue. Now, I would like to introduce Mayor Woodfin.
Hey, good morning, everybody. This is Mayor Randall Woodfin. I want to thank each of you all the employees for being on this call. I think right about now we have over 1,100 of our employees listening to this call, and that number continues to rise. So I'm glad many of you all are tuned in. Part of this, having this by phone instead of in person, is we are practicing what we preach, so we're intentional about practicing social distancing. Let me start with something really important, and that is I care for each of you. Not only on this phone, but all of our employees. I know many people outside of your job, your capacity, what you are hired to do and what you love to do, you are as concerned as any other individual that's a resident in our city. You have your family that you think about, your friends, your coworkers, your church members and everything else, your social clubs and all. And so I want to thank you for not only being city employees, but I want to thank you all for understanding what our job and role is. So there are a couple things I want to do. I want to have a conversation about what we're attempting to do and why we have to do what we do as city employees. And then I want to open it up, and we'll attempt to take as many questions as possible from employees. The first thing is this. The city of Birmingham has declared a city state of an emergency, along, of course, with the state emergency as well as the federal government's state of emergency. And certain things, even under emergency, are deemed essentials and critical. And so places, for example, grocery stores, convenience stores, drug stores, banks, gas stations, and things of that nature, none of those things will be closing because they provide essential services to the community. Very similar to them, the city of Birmingham as a government provides essential services to our employees and to our citizens. So even in the midst of a health crisis, people will still put out their trash, and they have an expectation that the city will pick up their trash. People still have a fair, realistic expectation, but that if they call 911, someone will actually pick up the phone. But if they need police service, someone will show up, and if they need services based on a fire or a health emergency, that the paramedics will show up as well. So we continue to provide essential services to our citizens. In addition to that, not only is this situation fluid, but it's unprecedented and for all cities across America. Because of that, we, through our enforcement powers, enacted a work-from-home policy. When we enacted this work-from-home policy, it triggered additional essential staff that had probably not been deemed essential staff in any other situation for two reasons. One, you have to serve the back end of what our employees need at home to make sure they're plugged in and can still provide their services to our citizens even if they're working from home. But the second thing is, from a tech standpoint, there's so many moving parts, and you all have to be in tune to what we're doing here so the left can know what the right is doing. The other part of this is some of those in this building at City Hall who, for the first time, are deemed essential employees. I want to explain that. As a government entity, we still have to provide services to outside organizations that are deemed essential, who still have to do work. So my favorite example I like to use is, many of you all know there's been a run on toilet tissue. Well, if you got a family, and it's a big family, and all of a sudden everybody's using all their toilet tissue, it's possible that your toilet could stop up. Well, if you call a plumber, or a person decides they want to be a plumber, they need to be in a position to come to City Hall, get a permit, or make sure the license is updated, or go through any process in the finance department or the permits department. That is just an example. There are many more examples I could give. The point is, many of you are saying, why all of a sudden I am deemed essential? Part of that is outside of our public safety employees, others are the backbone of the city's infrastructure. By definition, that makes you essential as well. And so all of us, as city employees, make sacrifices, and our job is to serve the public. And even though certain things are moving differently in our community, we still have to provide services for the public. And so I hope all of you all bear with us as we move through this fluid situation. We always attempt to strike a balance between this health crisis we're dealing with and being able to provide those essential services to our citizens and residents. The three things I would have stated, and I will continue to state, I've shared this with the public, and I think it's important I share with our employees. If you feel sick, stay home. Please continue to wash your hands and use hand sanitizer. And then three, as practical as you can, practice social distancing. Now, let me explain that. The only thing that has been enforced by either local or state law is no gatherings of more than, it was 25 people. As of yesterday, no gatherings of more than 10 people. Again, there are certain exceptions within that. To provide our city services, sometimes that's not always the case. In addition to that, the 6 feet is not a rule. It is a recommendation. None of us want people coughing or sneezing on someone else. So that's why that recommendation has been provided, but that is not a rule. The only rule that exists related to the COVID-19 situation is no gathering of more than 10 people in social settings. So that is not applicable to what we're doing here at the City of Birmingham related to providing city services to our residents. Now, I have Dr. Williford on the phone, who's been very active and a voice and leading, and he works for the Jefferson County Health Department. So when we open this up, if there are any health questions, I can lean to him. But as it relates to how we engage each other, at this point, I simply want to state that we all have a job to do. 2 is thank you so much. And 3, we will continue to monitor the situation every day, and because it's fluid, I can tell you some things as simple as last week we've enacted, we may have to change next week. So continue to bear with us. We got you all in mind, and we continue to work hard on your behalf. With that, what we'll do now is turn to and open it up for questions, so I'll turn it over to Rick Journey.
Thank you, Mayor. Our first question, are they going to make testing available for first responders?
So, you all should know I am in constant contact with the Jefferson County Department of Health as well as the leadership of the UAB Health Systems. And what they have explained over and over to us is that as of today, there is not enough testing. And because there's not enough testing, priority has been deemed for the following. If you are experiencing symptoms, 2, if you have been identified as being in close contact with someone who's already tested positive, and 3, if your service provider, i.e. your doctor, has sent you to be tested. As it relates to our first responders, the conversation I am having, along with other mayors are having with our governor, as well as our U.S. Senate delegation that represent us at the federal government level, is to make sure our first responders are covered and protected. We initiated that here at the local level Tuesday when we passed more resources to be given for personal protection gear. But we continue to amplify and champion making sure our first responders are taken care of. And when enough testing is available and there is no priority, then we want to make sure that our first responders are in line and in the queue to make sure that they are taken care of, including up to being tested. I want Dr. Williford, who's on this phone, to speak to this as well. Dr. Williford?
Dr. Williford may have been disconnected. We will get him back on the line momentarily. All right.
What's our next question?
Our next question, are there any options for the city to provide public works with hand sanitizers and masks?
Yes, we have already ordered more masks and sanitizer and hand sanitizer for our public works employees.
Just one moment, we're getting our next question pulled up. I'm not sure exactly what this is dealing with, but the question is it lawful to withhold benefits from first responders?
I don't think so, but no one from the city is withholding benefits. If there's more nuance or detail to that question, please frame it a different way and maybe we can try to address it. But the answer is no, that wouldn't be lawful, and no, we're not withholding any benefits.
We have a question here that says, at what point will the mayor address the police department not answering emergency calls to be more efficient?
Well, that's an interesting question. I'm not sure what that means. What I can do is take this question and give it to our police chief. What I do know, all calls are answered. There is a jam and backlog in 911 because we are receiving more calls in the last week and a half. But I will be sure to not only check with our police chief, Patrick Smith, but we will check down today in our 911 system to see what some of those issues are related to the 911 calls and response.
We have a question here. Can we use another method to sign in and out for work instead of touching the same time clock?
The answer is no. What we would suggest is using hand sanitizer before and using hand sanitizer after. In this building, what we've done is put additional hand sanitizer locations, not only in our elevators, but additional places as well. I know a lot of people carry hand sanitizer on them as well. Of course, you've noticed inside of City Hall, and it should be with a lot of other buildings that are open, operations, we have said to open doors so people can, so more people can stop using their hands to actually open doors. In addition to that, we put hand sanitizer in elevators, but I've also suggested that you use your elbow or your knuckle to press the button. But for the actual signing in, we highly suggest you use hand sanitizer before and hand sanitizer after.
Okay, we have our next question coming in right now. This is a question about what is the city doing for first responders with children under the age of 5? Most of the recommended locations accept young people starting at the age of 5.
So we continue to work with service providers and volunteers and the state who are actively right now working on child care for first responders. I know this is something that the health department is looking at, Jefferson County is looking at, as well as the city and the state. We have not actually found an answer to this question, but no, this is something we've been talking about since Monday. But I think an answer can come too soon, not just for our city, but other cities in the state, as we all look to find a way to offset some of the concern around child care related to our first responders, which includes children under the age of 5. We have one local organization that has offered that service. We continue to vet them to see is it feasible for our employees and do they have the bandwidth if we want to provide that service to our employees. But we still got some more due diligence to do before we can make that recommendation to our employees.
We have another question from first responders. How are we going to improve call screening? Officers are taking unmitigated risk without having proper protective equipment.
Hold on 1 second, everybody. The question was, how are we going to improve call screening? Officers are taking unmitigated risks without proper protective equipment. Again, the first thing is, the governor has signed an order allowing us to expedite the process to get this equipment to our first responders. The other thing I want people to know is, I got some information here from the CDC that talks about if close contact occurred during an apprehension. They have recommended that our first responders clean and disinfect duty belt and gear prior to reuse, using a household cleaning spray or wipe, according to the product label. In addition to that, it's been suggested that to follow standard operating procedures for the containment and disposal of used PPE, as well as follow standard operating procedures for containing and laundering clothes and avoid the shaking of those clothes. I think, though, if you want more information, not just here at the local level, but nationwide CDC recommendations for law enforcement who are performing daily routine activities, we know that there's some immediate health risks that are being considered, but those risks are extremely low. But we also suggest law enforcement leadership and personnel should follow the CDC's guidance. And so, just for your own leisure, if you would like, please check out cdc.gov, who continues to make recommendations for law enforcement personnel.
Okay, we have another question. This comes from somebody who operates on the lift loader, who is asking if after they run their routes, if they can go home, and if there was an opportunity to take one truck home.
The answer is no. What we are doing is considering 7-day work week to distance crews and rotating schedules. But that hasn't been fully decided yet. So the answer to that is no.
Our next question is, are you considering pregnant women being considered as non-essential employees at this time?
No. No. You all, okay, so everyone could possibly get the coronavirus. But I want you all to, at a high level, consider what's happening in the country of Italy. Italy has experienced more deaths at this point in time, even more so than China, because of their senior population. It is the most oldest population in Europe. The city of Birmingham has a very high population of our seniors and elders, and so they are the number one at-risk group of not necessarily getting it, but getting it and having a hard time recovering from getting it. Any of us on this phone could possibly contract it. The second highest group that is vulnerable are people with underlying health issues. That includes heart issues, diabetes, respiratory lung issues, and any other immunity deficiencies. Nothing from what the CDC has shared with us includes women who are pregnant.
Our next question, if you are a refuse collector, what do you do if you pick up contaminated trash?
Well, there's the same process our refuse employees should use for picking up all trash. I think that one of the most important things is the continued use of hand sanitizer, but that should be a second option because the first thing you should have on is gloves. And so, in wearing gloves and wearing that mask, you engage trash as you would any household.
We're working to get our next question pulled up right now. Just one moment, stand by. Okay, this person says, I have 2 small kids and called into her department to let them know she would not be in due to having her kids at home. She was told that she had to use her personal time. She wants to understand how some people can work remotely and she wasn't allowed when it was an emergency. Why does she have to use her personal time?
So this is Jill McIsaac. I serve as the Human Resources Director. So the reason why individuals have to use their personal time when they're at home caring for their small children is because those individuals are not available to be on call to come back to the city for work. Their primary responsibility at that time is taking care of their children, and they are allowed to use sick leave, vacation, or any other leave time, and they can, in fact, borrow up to an additional 80 hours of leave time. And as the mayor indicated, we will continue to review this policy in light of the new federal legislation and the FMLA that is required under that law.
Just to kind of give you an update, we've been on the line for about 20 minutes. We have about 1,100 folks on there. We do know we have a lot of folks that are on there, and we're trying to get through our questions as quickly as possible. Our next question deals with IT workers. It's essentially a statement: IT workers need masks. Is there an update on?
Masks are on order. We know there's a very high demand, but masks are on order to provide for those employees who have to engage the public.
The next question: will the police department be reinforcing the parks closing and there's still children playing?
Yes, they will be. I mean, the first thing is, we continue to have this public conversation with parents about how their children should engage. If the NBA, I'll use the NBA for an example. If the NBA stopped the use and playing of basketball because of not just the gathering of the spectators, but more so of players defending each other, playing against each other and sweating, then you wouldn't want the coronavirus to pass in any way like that. So it's really important that parents express to their children not to be playing at these sites. The park board has moved to close parks, but as many of you all know, those parks are still open spaces that children can just walk out to. So if any of you all see children playing in parks, don't call 911, but you can call the actual precinct, and I imagine that beat officers will be put in a position to be able to break that up.
Our next question: why do we have to borrow time during a national emergency?
This is Jill Medizik again, and while it is a national emergency, the city still needs to operate, and individuals who are off work do need to use the time that they have accrued. We are allowing employees to borrow future time if they don't have any current time, and the requirement that individuals use personal time is consistent with the new federal legislation, which allows the city to have employees go unpaid or to use their personal time for the first 10 days starting March 30th.
We have another question. HR email concerning non-essential employees without work assignments are working from home and will be paid. Essential employees, if they contract the virus, will have to use their leave time or borrow time. That's the question.
So the question is this: if an employee contracts the coronavirus while on the job or in the line of duty, then the answer is no, they don't have to use sick time. They can use workers' comp time.
Okay, we're going to our next question. It's very basic. Are layoffs possible?
I want to explain this to our employees. Many of you all know I've had public budget hearings, and I continue to discuss with our employees how we fund things in this city. Many of you all know, as a city, probably about 80% of our taxes is derived and dependent on business license, the combination of business license, sales tax, occupational tax, and use tax. You all should know that we are embracing for a deep impact and cut in our ability to produce revenue for the city based on businesses closing. As recent as 2 days ago, a small business owner told me between his 3 businesses he had to lay off 80 employees. So I want you to imagine 80 employees who, at a point, are not providing any occupational taxes to the city, not provide, because their stores closed, not providing any sales tax to the city, and that causes a ripple, not just for that small business owner, not just for that hourly worker that works at that small business, but it has a deep impact on what the city can do too. 70% of the city's revenue is spent on city employees. I want to make this abundantly clear. I have no desire to cut or lay off any employees. That would be an extreme last option. But that is nothing, that is not on the table right now. That is not anything we're entertaining. What we are doing is monitoring on a daily and weekly basis at this point income that comes into the based on those taxes.
Okay, our next question is, explain borrow time. How can we borrow time we don't have? I think Jill Medizik has joined us once more.
Again, as a result of the executive order and the state of emergency that the mayor has declared, generally, borrowed time is not allowed, and so this is a situation where we have
It's working.
allowed us against future time that will be earned.
Jill, just one moment. Let me pause for a moment. We have somebody that's unmuted, so stand by 1 second. We're trying to clear that so you can hear everything that Ms. Medizik is saying. Okay, let's start that again. The question was dealing with explain borrow time. How can we borrow time we don't have? Ms. McDizik?
Yes, as part of the mayor's executive order, he did take the unprecedented step of allowing us to borrow time against time that we will accrue in the future. If an employee has exhausted all of their sick leave or vacation time, or an employee is too new to the city to have enough time to cover this situation, you can borrow against future time, and that is an additional benefit the city is offering to employees. The process would be to borrow time, would be to send a request to Human Resources to borrow time directly or through your payroll coordinator, and Human Resources will review that time and make a determination and lend you the amount of hours necessary, and we will notify you of that.
Okay, we're pulling up our next question right now. Stand by. I think this is kind of similar to the next question, so we'll ask it again just to kind of clarify a number of questions dealing with time. If you contract the virus, will employees who are currently working have to use their own time if they're sick? What occurs if they don't have any time remaining?
If they contract the illness as a result of them performing their job, they will not have to use their own personal time. That would be covered through the workers' compensation system. If an employee contracts the illness through outside contact, so not on job, so from a family member, friend, etc., the employee would need to use their own personal sick leave, and if they have insufficient sick leave, could borrow against future time.
Thank you, Ms. Isaac. So we're moving on to our next question. This is coming from somebody concerning grass cutters. What is the difference between DPW and the County Public Works? County is off, but the city DPW is still required to work.
The entire Department of Public Works team has been deemed as essential, providing continued service to the city of Birmingham while this crisis exists. The best example I can give is just yesterday I encouraged families. I know this is fluid, but I encouraged, go take a run, go take a walk, go biking, go to a park. Well, we still own those parks. If we still want our residents in those parks, then as it relates to the maintenance of those parks, is responsible, we still engage in that. And so I'm not in a position to compare City of Birmingham to any other public entity, but the entire Department of Public Works team from day one has always been identified as essential service.
I'm gonna, while we're on the line, I just want to point out, we had Dr. Wes Williford from Jefferson County Department of Health on the line. He was having trouble actually being heard. We're trying to get the technical aspects on that. I wanted to see, just to check in, Dr. Williford, are you still on the line? Are you able to comment? Okay, we're still trying to figure out what the challenge is with that, but we will move on to our next question here. If an employee has been quarantined for 14 days and we're on a truck with her, what is the protocol?
So at this time, we evaluate each situation case by case, but based on criteria from the CDC, as well as looking at our critical infrastructure, those employees may be quarantined or asked to not work for a 48-hour period while they seek a test, but in most instances, we are not requiring those contact employees to be quarantined for 14 days at this time. There is no evidence that just being in the close proximity of an individual doing your daily tasks is high risk.
All right, thank you. I think that we have been able to determine where Dr. Williford is on this line as well. So we're going to try to open up his phone line and let him comment. Just stand by for 1 second as we do it. Dr. Williford, if you can hear us, we're about to see if we can coordinate to get this line open. All right, I understand. So we're still having a problem on his line. Okay, so we're going to work to get him on the line momentarily. Let's move on to another question. Given the unprecedented event in life, uncertainty in general, will the city consider reinstating a leave bank or creating an opt-in employee compassion fund?
Actually, the city has been working diligently on creating a sick bank and a compassion or vacation bank. We fully anticipate that once this crisis is over, that we will be rolling out that sick bank, and we will make provisions in that bank for individuals who have had to borrow time to be able to apply to the sick bank to recoup some of those hours.
Okay. The next question, will we, and I'm not sure what the circumstances are, but will we get paid time and a half? I'm not.
Yeah, only individuals who work overtime hours will be paid time and a half.
Just 1 second, we're going through. Again, like I said, we have about nearly 1,100 folks on this line. We're trying to get through as many questions as possible. The next question, will first responders who are unable to find child care or use child care resources that have been made available be penalized if they are unable to find child care? Some places are setting ages. I think we may have asked this question, so I'm sorry, I didn't remove that from the queue. I apologize for that.
I think everybody, what you will get is a follow-up and separation and isolation only about the topic around child care for first responders. Please bear with us as we seek to find a solid solution around child care related to first responders.
Okay, let me move on to our next questions here. For employees who have traveled or already paid to travel, what is the process to returning from personal vacation?
So at this time, pursuant to the executive order, individuals who are returning are possibly quarantined from 48 hours to 14 days, depending upon where they traveled and how they traveled. As the mayor indicated earlier, that policy was developed before we actually had any cases here in Birmingham, and we will consider and look at that portion of the order to determine if a revision is necessary.
So our next question here is, what is the point of social distancing if you can't contract the virus in close proximity of someone?
What is the point of social distancing if you can't contract the virus? I don't think I understand the question. What is the point of social distancing?
I think it was misspelled. I think it's if it can contract the virus in close proximity of someone.
Well,
I can answer that if you'd like.
Dr. Williford, you're back. Go ahead.
Hey. I apologize for the difficulties. So the question there. So what's the point of social distancing if it's difficult to contract the virus while in close proximity? So it is easy to you can contract the virus when you're close to someone for a long period of time. The reason that social distancing is important as a society is that as we spread our distance out from other people, as we avoid large gatherings, what we're doing, it may not prevent the idea is to prevent a lot of people from getting the disease all at once. Because what will happen is if we have a ton of people getting sick with this virus, then what ends up happening is our hospitals become overwhelmed and can't take care of all the patients who would need care, and that's a disaster situation that we're trying to avoid.
Dr. Williford, while we have you on the phone, you've heard some of this conversation. Is there anything you want to say to these employees?
I think the biggest thing I would say right now is really to drive home that notion of the social distancing as much as is feasible for our city and essential employees, because the temptation is of course there to go out to see friends. I know that there are fewer and fewer places to do that now, but really trying to limit those contacts, because what I always tell people, it's hard to know. You meet some friend. You don't. It's hard to know who all they've met in a day, and then it expands out very rapidly. So, again, the idea being is we're trying to slow down and cut off the chances for this virus to spread to a lot of people. We know we have people who have tested positive in the Jefferson County area, but what we're wanting to do is to keep that number as low as possible for as long as possible to avoid the bad side effects of this pandemic.
Thank you, Dr. Williford. So the next question was centered around, do we have a time frame for when our employees will report back to work? Based on what Dr. Williford just said, the answer is no. There's no actual time frame. However, we will be leaning in hard on our department heads as it related to staff deemed essential for rotation as it relates to for some who are currently at home to be able to switch out for those who are currently in office. And so that, again, is a fluid situation that we will continue to monitor on a daily, weekly basis.
If I may ask another question, since Dr. Williford is on the line, on the timeline, I know lots of people are saying, how long is this going to last? Can you just kind of talk in a very broad strokes, because obviously nobody has a good answer, but can you talk in very broad strokes about what you're observing, how public health officials are moving forward?
So what I would say is that what we have to do is the best information we have is what has gone on in China, because as of for the past 2 days, I don't think that China has reported any new cases. China underwent some very extreme social distancing, and they were able to slow the spread of this virus, and actually are now showing that they've probably stopped it. They've had a few people test positive that have traveled into China, but within China they have been able to stop the spread of this virus. So I guess what I want to say is that it took them some time, a month, 2 months. That's the sort of time that we're talking about, and it could be even a little longer. But it's hard to know exactly how long these sorts of disruptions will have to continue to really get on the other side of this virus. And a lot of it's going to depend on how well our community engages in these efforts to keep our distance from each other.
Thank you, Dr. Williford. Our next question, I think Ms. Mediza can assist us with this, returning from personal vacation. This person said they're returning from personal vacation. Will employees have to use their own PTO during the quarantine period?
Yes.
All right, thank you. Those short answers catch me when I'm trying to get to the next question. Sorry, I'm coming around. So the next question is, what is the mayor doing to move test sites in Birmingham or for employees?
Actively having conversations with the state, with the county health department, and with UAB health systems. I've made myself very clear on behalf of the residents of the city of Birmingham, acknowledging that in this city limits, a lot of people can't get from point A to B. Even if there are currently 2 test sites, one south of the city limits of Birmingham, which is in the 284-59 area, and one west of Birmingham, which is in the city of Bessemer, which is a couple cities over. I've been explicit. I have stated at some point within the next day, and this was stated 2 days ago, so within the next 3 to 7 days, if there is an additional testing site that will be here in Jefferson County, we need one on this side of the mountain in the actual city limits of Birmingham. I'll continue to advocate for that to make sure our residents have access to an actual testing site.
Our next question, is the city going to get on a shutdown or a curfew?
As of today, no. That is something we continue to assess on a daily basis. And again, the situation is fluid, so that is an option that we have looked into, but we have not made a decision.
Okay, our next question. When the rotating schedule is completed with IMS, will employees continue to receive pay even if they're not listed on the rotation schedule?
If the individual is not working as a result of the direction of IMS director, because they currently don't have any telework to do, that individual will get paid.
Okay, as we pull up the next question, Dr. Williford, while you're on the line, I think a lot of folks heard the announcement that you made yesterday, or that Dr. Wilson, the county health officer, made yesterday. Could you update folks on the line as it deals with what those guidances were made?
Sure. So the biggest change, probably the most sizable change that we had in there was, so previously we had issued an order saying all gatherings of 25 persons or more should not continue. That has been lowered to 10 persons. All gatherings 10 persons or more should be canceled and should not be engaged in. Of course, we've still left the senior citizen centers closed, and the schools that have been closed as well. And that's through the Alabama Department of Education as well, and then we've made we've also asked that non-essential services be closed. And when we think of non-essential services, those are the things that are absolutely necessary for conducting day-to-day life: grocery stores, banks, institutions like that, pharmacies, doctors' offices, healthcare facilities. The ones that are going to make sure that society can continue to function. But this is all part of our measure to make it very easy for people to engage in social distancing. If we don't do these things, we're going to see an astronomical increase in hospital admissions and likely an astronomical increase in deaths, and that's why we're making these very strong efforts right now.
Okay, our next question is, and let me pull this one up just one moment. Our next question is, when numbers of cases spike in the community, are we ready to respond?
Dr. Williford, you want to take that first?
Sure, be glad to. So as they spike, the hospitals are actively preparing. The health department is actively preparing. I know throughout the state, all officials are beginning to try to plan for this. We're going to be as ready as we can, but part of it to blunt this spike, that's why we're having to call on everyone. We can't go in and lock every single person into their house by ourselves. We have to ask people to help us out. We have to have community support to be able to keep that spike absolutely as low as possible. And that's the thing, is like if we don't engage in this, there's a spike that we can handle, but there is a spike that the healthcare system will not be able to handle if it goes too high. And the only way to prevent that is by engaging in this extreme social distancing that we are recommending. Because if the virus can't spread, that means fewer people are going to get sick, fewer people are going to go to the hospital, and our hospitals will be able to better handle that volume.
So everyone, I have 10:45. We wanted to spend about 45 minutes with you, and I know there's still over 1,000 people on this call. So there's an option to continue to send questions, and let me get that process right quick. Hold on one second. So I'm gonna have Rick Journey explain to you how do you leave a message while still on the phone, so we can get your questions answered.
So we have many, many questions. I'm noticing with some of the questions that come in, some of them are very similar to what was brought up earlier in the call, so there's very likely some people are joining the call as it goes forward. A few things to let you know. When you we are going to post this call later today. It's a very, very large file, so it takes a little while for us to download it. Once we download it, we will post it on 2 locations. If you go to birminghamal.gov, you will see it. If you scroll down to the bottom of the page, you will see Newsroom. That's on the city webpage. It's birminghamal.gov, and it's slated as Newsroom. We will have a headline that basically says Tele-Town halls. It will have the date, and it will have the subject matter. If you click on that link, you will be able to view that. Now, let me stress to you, it won't be ready for at least an hour or so, because these are large files, and it takes some time to download them before we can post them. But they will be up. Another way you can do it is we have calls that have been put in the deck, but you can also, let me double check. Okay, so if you have a question that you want us to address when this call ends, you can press 7 on your keypad. It will prompt you at the end of the call, would you like to leave a message, and you will be able to leave a voice message at that time. Hold on one second. Yeah. So a key point of that, though, is when we finish this call, please stay on the line. If you press 7 and you leave a voicemail at that moment, you need to stay on the line at the end of this call. You won't be immediately disconnected. So just to run through that again, if you have a question that has not been answered and you would like to leave a message, once this call is complete, stay on the line. You can press 7, stay on the line, and then leave a voicemail message. We will post this on the city website, and we will continue to do everything we can to keep you up to date. So that's the instructions to deal with that. I know Dr. Williford is still on the line. Mr. Mayor, do you?
One is 2 things. Thank you, Dr. Williford, for being on this call. I'll be very brief. Again, a reminder that this call will be recorded and posted on our website within an hour of this call, or roughly so. 3 notes. One is this situation is very fluid. That means some things will be unpredictable. We will continue to monitor this situation on a daily basis. We've never experienced anything like this in our lifetime. So thank you for being in the trenches with us. 2, from an information standpoint, I commit to you on this phone, we will continue to over-communicate with not only our residents but our employees, actively keeping you informed of what's going on and what we're doing on your behalf. The last thing, which is extremely important, please remember our citizens depend on us, just like hospitals, just like grocery stores, etc. And we'll work hard to take care of you because you are taking care of them, and we're all putting people first. Thank you so much for your commitment to the city of Birmingham and the citizens we serve. Thank you.